All right, so we'll look at um, psychoanalytic drugs and then their effect on altering our consciousness and the consequences and effects of them for humans. And so, first, just trying to understand some of the categories of drugs. Psychoactive drugs refers to, in general, it's a chemical substance that modifies mental, emotional, or behavioral functioning. Generally, when we talk about illicit drug use, drugs that people are on, that's what these go under. And so, the first we have narcotics or opiates. Those are drugs that are capable of relieving pain. Sedatives are sleep-inducing drugs. Stimulants are drugs that increase central nervous system activation. So these are uppers. Sedatives are downers. And then you have hallucinogens, which are drugs that really affect your mental and emotional functioning. And they do that by distorting sensory reception and perceptual experience. And so they affect the way we experience the world around us. And so we're going to look then at various psychoactive drugs, their effects on the central nervous system, the effects on the brain specifically, and then the effects on behavior. And so alcohol serves as a depressant on your central nervous system. Specifically in the brain, it decreases dopamine levels. Its effect on behavior: increased dizziness, slurred speech, and impaired or really bad judgment. And high doses of alcohol can result in respiratory depression and eventual death. So if you have too much alcohol, or if you become alcoholic, in terms of your behavior, it could slow your breathing rate until the point where you die. Barbiturates also act as a depressant, and those are Seconal and Nebutol, and these are generally drugs that are used as anti-convulsion drugs, so to stop seizures and things of that sort. It could also be used pre-anesthesia on patients, and so that kind of makes sense then with what we have here. Is a depressant on the brain. It inhibits neural arousal centers, so it kind of makes those neurons less likely to fire. In terms of behavior, it decreases anxiety, increases relaxation. High doses of it can result, again, like alcohol, in respiratory depression and death. These can be super addictive, and if you mix them with other depressants or alcohol, can cause you to die and are very dangerous. Tranquilizers like Xanax, Valium, and Librium are also depressants. They also inhibit neural arousal centers, and they reduce anxiety without causing sleepiness. And so people who have anxiety will take these sorts of drugs because it helps them deal with their anxieties. But again, that's only through prescription. Otherwise, it could be problematic. Caffeine serves as a stimulant. It causes your brain to accelerate your heart rate and constrict blood vessels. Again, that's not really ideal. If your heart rate is going faster, but your blood vessels are getting smaller, it makes it more difficult, causes your heart to have to work faster. It reduces levels of adenosine, and that's a regulator of norepinephrine that controls that release. And so this can lead to people getting irritable. It can lead to increased anxiety. And it can also lead to insomnia. This is why people can't drink coffee late at night, because sometimes this leads to insomnia. They're not able to sleep if they've had caffeine late at night. Other drugs, amphetamines, such as diet pills or Ritalin, serve as stimulants. Also, these increase the body temperature and the heart rate. They increase production of dopamine and norepinephrine, and these can be addictive. They produce feelings of euphoria, but high doses of those can lead to motor dysfunction, so you may have inabilities to move around or stay balanced or things of that sort. So those are amphetamines. Cocaine is another stimulant. Again, similar. All of these that fall in the same categories have similar effects on the brain, although different effects on behavior. This cocaine can stimulate the heart rate and blood pressure, increases dopamine, serotonin, and norepinephrine release. So it just gets you more heightened. Users, the effects on the behavior is people who use cocaine feel like they have increased mental abilities and social abilities. They do not. They just think that. That is what happens when you mess with these neurotransmitters. And cocaine can be highly addictive. It's not the most addictive. That award belongs to heroin, but it can be highly addictive. Nicotine is also a stimulant. It stimulates acetylcholine transmission. It increases your heart rate. And so you'll notice that for stimulants, they all increase your heart rate, which generally puts undue stress on your heart. And so that's why you want to avoid, in general, the use of stimulants, because it makes your heart work harder than it should. What's interesting about nicotine is although it's a stimulant, its effects on behavior are much more like a depressant. So you have a decreased appetite, and then you have the increased heart rate and respiration. So it makes your body work overtime, your heart and your lungs work overtime, but it decreases your appetite. Nicotine can also sometimes cause euphoria and dizziness. The last few we'll look at are narcotics, such as heroin. Again, this is a depressant, and it activates receptors for endogenous endorphins. Essentially, it increases your body's ability to create those endorphins. It makes your neural receptors more receptive to endorphins. It gives you this temporary high. It induces relaxation and euphoria. It can be used to reduce pain. Problems is it impairs your cognitive ability, that is your ability to think. You sweat, you become nauseous, and you have respiratory depressive. These are highly addictive, available only by prescription or through illicit means. You don't want to be taking these things. They can really, besides their psychological effects, the physical effects are pretty bad. And then hallucinogens include things like LSD and marijuana. They distort your sensory perceptions. They may increase serotonin levels. And so these may induce sensory synesthesia. And that is when your senses kind of synthesize together. So stimuli from one sense, like you hear something, and that produces sensory effects in other modalities such as vision. So you're hearing something and you think you're seeing something, or you're hearing something and you think you're tasting something. So it really kind of throws you for a loop. And occasionally these perceptual alterations are really unpleasant and terrifying. And so this can sometimes lead to paranoia. And so people who do these sorts of drugs sometimes experience this paranoia and overwhelming sense of fear, which can lead to anxiety and troubles. So when we're talking about people on psychoactive drugs, there's a few terms that we need to be aware of: dependence, tolerance, and withdrawal. And dependence is when an individual keeps using a drug despite the fact that all they're experiencing is negative consequences from using that drug. And they keep using it to avoid the unpleasant physical and or psychological feelings that are associated with not taking it. So this is the kind of the new term. Dependence is replacing the term addiction in the medical field. It's just a different way of looking at things, is that these people are physiologically and psychologically dependent on these drugs. And despite the fact that there are only negative consequences, ranging from like sweating, nausea, all the way to jail time or death, people keep taking it because they are so dependent upon it. And so physically they are dependent upon it. Their body needs it. Physically it craves it. And then psychological dependence is also biologically based, right? Like these enjoyable behaviors or use of these sorts of drugs produces activities in dopamine circuits in your brainstem. And so your body expects those dopamine circuits to be running. And then the more you use drugs, the more they run. And so psychologically, your body's like, where's my dopamine? Where's my dopamine? Where's my dopamine? And so your body is dependent upon it. Tolerance occurs when increasingly larger doses are needed in order for the same effect to occur. So the first time you do a drug, you may not need as much to get high as if the 50th time you do that. What's worth noting is that people can develop a tolerance without developing a dependence upon the drug. And then withdrawal is the process of going off of a drug that you have become dependent upon. And this is just overwhelmingly, when you talk to people who have gone through this, a miserable process. Sweating, nausea, vomiting, the shakes, even potentially even more hallucinations. It's your body going through detox. There are physical and psychological symptoms that are highly unpleasant to go through. And part of the reason why people stay dependent upon drugs is because they are afraid of these symptoms that come along with withdrawal from the use of drugs. So without getting too into it, that's kind of what different categories of drugs do to us psychologically and then behaviorally. And then when we're dealing with people in psychology who are drug users, we need to recognize these terms of dependence, tolerance, and withdrawal.